Hi there. I've been reviewing some patient cases and noticed a common confusion between chronic kidney disease (CKD) and acute kidney injury (AKI). It's crucial to differentiate between the two for proper management.
Absolutely. While both involve kidney dysfunction, they have different causes, clinical presentations, and management approaches. Let's break it down.
CKD is characterized by gradual and progressive loss of kidney function over time. It's typically caused by underlying conditions such as diabetes, hypertension, or glomerulonephritis. Patients with CKD often have persistent abnormalities in kidney function tests and may experience complications like anemia, bone disease, and electrolyte imbalances.
Right, whereas AKI is a sudden and often reversible decline in kidney function, usually occurring over a short period. It can be caused by various factors such as dehydration, sepsis, nephrotoxic medications, or urinary tract obstruction. Patients with AKI may present with symptoms like decreased urine output, fluid overload, and electrolyte abnormalities.
Exactly. One key difference is the timeline. CKD is a chronic condition that develops gradually over months or years, whereas AKI is an acute event that occurs suddenly and may resolve with appropriate management.
Another important distinction is the management approach. In CKD, the focus is on slowing the progression of kidney damage, managing complications, and addressing underlying causes like hypertension and diabetes. On the other hand, AKI requires immediate intervention to identify and treat the underlying cause, support kidney function, and prevent further damage.
That's correct. Treatment strategies for AKI may include fluid resuscitation, electrolyte management, discontinuation of nephrotoxic medications, and addressing the underlying conditions such as sepsis or hypovolemia.
It's essential for healthcare providers to recognize the differences between CKD and AKI to provide appropriate care and prevent complications. Early detection and intervention can significantly impact patient outcomes and prevent progression to more severe kidney dysfunction.
Absolutely. By understanding the distinct characteristics and management principles of CKD and AKI, pharmacists can play a vital role in optimizing medication therapy and promoting kidney health in patients across various healthcare settings.